Good morning, dear friends. Let us discuss about the type of teaching that should be imparted as per the CBDC pattern. So there are three types of teaching: horizontal, vertical and spiral. In horizontal type of teaching, we have to integrate between the subject of the same class. For example, for first year, you have to correlate between anatomy, physiology, pharmacy, organon and mathematics. And in case of vertical teaching, we need to correlate the subject vertically: first year, second year, third year, fourth year. For example, when we are going to teach medicine, we have to correlate with surgery of third year, pathology of second year and anatomy and physiology of first year. That is called vertical teaching. Then spiral teaching. Spiral teaching means when we study deeply in any topic, that is called spiral teaching. Let us give some examples of horizontal teaching. When we correlate in first year the subject anatomy with mathematics. For example, in mathematics, under the medicine belladonna, it has been mentioned in Allen's keynote that there is pain in right ileocecal position. So in ileocecal position, the organ that is appendix is present. That knowledge will get from anatomy, where the ileum and cecum, the joints, in that place the structure appendix is present. When there will be appendicitis, that is, there is inflammation, there is pain in right ileocecal position. So that knowledge we can able to get by integrating the homeopathic mathematics with anatomy. Then let us come to the vertical teaching. For example, we are going to teach pathology. So when we'll discuss about the pathological subject like inflammation, so in inflammation, the 5 signs of inflammation we are getting, and we can correlate inflammation with different organ. That knowledge of organ we will able to get from anatomy. The normal function of the organ we will get from physiology. Then the same thing we have to discuss in surgery. For example, in voil or abscess or carbuncles. So all the area where that appears, that structured knowledge you will get from anatomy. Then the pathology you will get from pathology, and surgical knowledge we will get from surgery. And if it is controlled by medicine, then the medicinal knowledge we will get from mathematics as well as from practice of medicine. So this is vertical teaching. In spiral teaching, in homeopathy, we are having the concept of dynamic. So vital force is a dynamic force which is not measured, it cannot be seen, or it cannot be weighed. And about the vital force, when you teach the students correlating it from cosmic vital force and how the vital force entered inside the zygote, what happens and in which way the vital force operate, if we'll touch these things to the students precisely, that is called spiral teaching. That means critical teaching of any topics from the history or origin to the outcome, that is spiral teaching. So these are the different teaching or mode of teaching every teacher of a homeopathic college should know, and that should be imparted to fulfill the CBDC pattern of teaching. Thank you very much.